All right. Welcome, everyone. My name is Sean Thibodeau. I'm the coordinator of community planning for the Paul Memorial Library. It is my pleasure to welcome you to tonight's lecture given by our resident pandemic lecturer, Dr. Robert Forrant. He gave a talk on anti-slavery in Lowell last September. And then in November, he gave a talk on the history of the American Civil Rights Movement from 1950 to 1975. And he's here tonight for a three-peat to give a talk entitled, "We've Been Here Before, the 1918 Influenza and What History Should Have Taught Us." Robert's been a faculty member at the University of Massachusetts Lowell since 1994, is a distinguished university professor of history and director of the department's graduate program. He's the co-host along with Maritza Grooms of the popular LTC show History in Lowell. You can find episodes on the LTC site or on YouTube. He's a busy man with his hand and mind in many historical projects across the Commonwealth and the nation. And we're thrilled to have him here again with us. Please welcome Robert Forrant.
Thank you, Sean.
Yeah.
All right, that should get everybody the slides, and unless I hear any screaming, I'll assume it's working. So my plan is to talk for perhaps about 35 minutes and then leave enough time for discussion, chat questions, however we end up trying to deal with it. And I started doing this because I am this semester teaching on campus, and I'm teaching a U.S. history survey course, U.S. history since 1877. And as I was working my way through preparation over the winter break for the course, it struck me that while I had always mentioned the 1918 flu pandemic, I had never really spent a lot of time thinking about it or talking about it. And I thought, okay, well, this is a good opportunity. I can build it into the class. And the more I started researching and reading and thinking about it, the more I realized how much resonance what happened back then has for the current situation, and how much, if we had paid attention to that past history, we might have done a better job this particular time. And so I want to talk about the more general situation of the pandemic at first, and then toward the end of the talk, I'm going to talk far more specifically about Lowell, what was happening in Lowell, how the city was organized to deal with the pandemic over the fall winter of 1918, and actually stretching into 1920 and 1921. So one of the things, again, that I found striking as I was working my way through the history is how much a lot of the same rhetoric was used in 1918 to get people to think about what to do, as well as now. And so I was struck by how much people tried to impress upon the average citizen, people in public health, the importance of a mask, the importance of, basically creating some level of social distance. There was a really big worry in 1918, and there was a constant reference, and you saw in one of the earlier slides, the idea of telling people not to spit. Apparently spitting was just a very acceptable thing to do as you were walking down the street. If you felt like spitting, you did. And so sign after sign after sign I found from all over the country, there was always something about spitting. But this notion right at the top of this particular slide, do not take any person's breath. I just found fascinating. The other one was keep your mouth and teeth clean. I found a lot of ads for various toothpaste companies saying the way to beat the influenza, or the grip as it was called back then as well, by making sure you brush your teeth regularly. And so there's a lot, as we'll see in a few slides, a lot of home remedies that people came up with as ways to try to deal with this. One of the more striking differences, and this is something my students picked up on, is that the mortality rate was highest amongst young people. And I'm not a physician, nor do I play one on TV, so I couldn't really delve that deeply into what the actual biology or physiology or whatever it was. But this was really a disease that attacked young people, particularly people between the ages of 20 and 40. And it was highly aggressive. Even it seems more aggressive than than COVID. There are a lot of oral histories I read and a lot of newspaper accounts that talk about people getting this in the morning and being dead by nightfall. That it really came on to you really quick and that it was really incredibly debilitating, and you know, just something that struck people really hard. Colleges and universities, my students love this slide. Colleges and universities responded to the pandemic in the fall of 1918, in many cases by moving classes outside. This is a physics class outside in Missoula, Montana. It looks a little nippy. They all seem to be fairly well bundled up there. And again, this is something my students loved. I'm teaching 40 students this semester on campus in a room that holds 300 people. And so this struck them as similar. It's sort of like we're in a stadium. But lots of colleges and universities moved classes outside. Lots of public schools did as well. This came on fairly quickly, and just between the fall of 1918 and the end of 1919, globally, it killed more than 50 million people. Very similar response, quarantine centers set up, emergency overflow hospitals like the one pictured on the screen, lots of urgings of people to wear masks, and again, lots of parallels between then and now. This gives you a idea, a reference point for the impact at the time in all the various wars that the US has fought, the accumulated fatalities, about 637,000, the flu pandemic, 675,000. We're at about 570,000, I think, right now with COVID, but it gives you a good reference point. And so you can see in World War I, while we're fighting the war, there's 116,500 casualties, deaths in the war, and there's almost 5.5 times that from the flu at roughly the same time period. This is one of the ads that I found fascinating. This basically suggesting that if you took this mint tablet, it would essentially clear up any possibility that you would have of being infected by other people. And essentially, basically, you're instructed by the Dr. Hopkirk there to take 4 or 5 a day. I actually went online to see if I could buy any, just to see if it would work, and I could not find the brand, but this was one of the ads that I found. At work, people continue to go to work. There was not a lot of work closures that I was able to find. Some stores and bars and things like that were closed down in Lowell. Talk about that in a minute. But there are a lot of photographs of people working in office buildings, telephone operators, bookkeepers, clerical workers, things like that, where people are sitting at their work wearing masks. And these are promotional ads to tell people that they can go to work, but they need to be wearing a mask. This is something I did not know at the start of doing this work, and I probably should have. But researchers now believe that the first flu variation in 1918 actually came from contaminated pigs in Kansas, and that the disease somehow from the pigs infected farmers in a really small town in Kansas. It was easily transmissible. And as we were more and more engaged in preparation for sending young men overseas in the First World War, and people from Canvas and other places traveled to training bases, they actually brought the flu with them. They took the disease onto military bases and then obviously onto transport ships and then to European battlefields. There's mention in a lot of the literature I was looking at of people actually dying, US soldiers dying on the troop ships on the way over from the flu. And as evidence of that, and as evidence of the awareness people had, this is an Army regiment in Seattle in December of 1918, on their way, getting ready to move out and slowly make their way across the country and then across the Atlantic to France. And they're all marching with masks on. And so it's fairly well known by this point that that the disease is here and is spreading. But again, we're marching people off to war and they're bringing the disease with them. A remedy that was pushed hard during this period of time on military bases was for soldiers to gargle every morning with salt water, and that this would prevent influenza. This photograph at Camp Dixon, New Jersey. I know my mother, when I got a sore throat, would always put salt in a cup of warm water and have me gargle salt water. And so I kind of laughed a little bit when I saw this photograph in the Library of Congress holdings. But again, people were grasping at anything to try to understand what they might do, how they might prevent the spread of the disease. The big problem in terms of the spread came because around the world, as we were fighting the war, the US and other countries imposed for a long time in 1918, through almost the entirety of the year, a news embargo on actually talking about the flu and how bad it was. And the US, as they became more involved in the war, passed the Sedition Act in 1918, and it called for up to 20 years in prison if you criticized the government or spread information that the government could determine hampered the war effort. And one of the things that could hamper the war effort was people spreading pessimistic stories. And the government determined that talking about the influenza was in fact spreading a pessimistic story. And so for 9 months in 1918, there was very little of a public health response in the US and elsewhere in the world as well about the influenza, about the grip. Newspapers in Washington, D.C. did not report anything about it for the first time until after August of 1918, almost, so there's like 8.5, 9 months. President Wilson downplayed the pandemic. He did in fact get infected, as did a bunch of his staff. He never made a public statement about the pandemic his entire time in office. And to keep up the morale during the war, he and people around him simply lied about it and just said it was just an ordinary flu. And they really tried to minimize it as much as they possibly could. And there are some people who believe Wilson actually got it a second time when he was in Paris trying to negotiate a treaty to end the First World War. But this struck me as in some ways so similar to the experience we went through with President Trump of downplaying it, minimizing it, denying that it even existed in the beginning, no big deal, nothing to see here. And again, I was struck by, as were my students, this similarity between the periods. This helps you see how quickly this spreads. This is a map in early 1918, and the red circles are where there is evidence of flu in early 1918. And again, 1918 is a year of war, of the First World War, and there's massive troop movement, people moving around the globe. And so if you can sort of visualize this one and then look at the next one. So I'll go back and forth a second time. One of my students yelled, "Gee whiz," when he saw this one. But you can see how quickly the dots amplify. And this quickly becomes labeled as the Spanish flu or the Spanish influenza. And it's because Spain during the war is neutral. So Spain does not have the news blackout that European countries have or that the United States has. And so Spain is reporting all the time about cases in Spain, more cases throughout 1918, new cases, what are we going to do? We have to do something. And so people, because it's not being covered in any transparent way anyplace else, are all sort of thinking, what the heck is going on? What's up with Spain with the Spanish influenza? And so Spain gets labeled with this, it gets hung around their neck, when again, actually most researchers now are pretty much in agreement that this actually starts in the United States. These are some of the ads that begin to appear in local newspapers, Massachusetts papers, Lowell papers, other papers around the country, and as well in Canada. There's one in Canada on preventing the flu, and you buy this oxygen delivery system, or you buy Lifebuoy soap, or easiest of all, if you keep warm, dry feet, you're going to prevent getting the Spanish flu. And so go to the boot shop at Hastings Street West and live large with your new shoes and rest that you'll never get the COVID. Other things that get pushed hard, drinking bone marrow from cattle, drinking this beef elixir advertisement on the screen, and also one of my favorites, eating more onions. One of the best preventatives for influenza, a carload of onions will be on sale at Bessemer Freight Station today and tomorrow. Bring your own sacks or baskets if possible. The prices are right. Patriotic drive against the flu. Eat onions. We also have our anti-maskers. There's a national anti-masking organization. This is just one of the ads from meetings that were being held in San Francisco in 1919. And again, this basically this particular meeting is called to try to get an ordinance to wear masks taken off the books, essentially making the case that wearing a mask is unhealthy. So lots of similarities. In Lowell, in September of 1918, September 20, this article appears in the Lowell Sun, talking about how 15 die at Air. Air is Camp Devens, where military people are stationed, either getting ready to embark from Boston to go to Europe, or where they can be delivered when they come back. They may be stationed there for a little while before they're discharged from the military. And 15 people die, soldiers victims of pneumonia developed from cases of influenza. Largest toll in a single day, but here again, downplaying the significance. Doctors are confident epidemic is waning, and no grip ban in Lowell, which means that soldiers on their weekend passes will be making their way to Lowell, and it says at the tail end of this piece. People not having symptoms will come to Lowell tomorrow and Sunday as usual. And we're going to see what happens fairly quickly. This is an emergency field hospital set up in Brookline to take the overflow of cases that are beginning to appear starting in late September, early October of 1918. There's not enough hospital space. There's no possible way to take care of everybody inside the existing hospital facilities. An emergency hospital like this one's going to be set up in Lowell as well. September 18th was the article about people coming if they don't have any symptoms from Fort Devens. September 20, first cases appear officially in the city, and the next day, all city hospitals banned visitors. By September 24th, new cases reported daily are exceeding 100. So that quickly, from September 18, no worry, nothing to see here. Troops from Fort Ayers can come to Lowell for R&R or whatever it is they're going to do in Lowell. Nothing really to worry about. By September 24, numbers of new cases being reported daily exceeding 100 a day. So that quickly, this makes its appearance in the city. Within another few days after that, Massachusetts makes an appeal actually to President Wilson and governors of other states to send help. Massachusetts is being inundated with the influenza. There's not enough doctors, there's not enough nurses. Lowell schools and theaters are going to now close down. There are conferences every day, sometimes 2 or 3 times a day at City Hall, as people try to get their head around what's happening. Because again, this is coming really fast and nobody quite knows what to make of it. And because there's not been a lot of conversation up until this point, because people try to keep a lid on it, nobody's really quite ready to get their brain around it. And this is being now fear of epidemic in Lowell. So again, September 18, nothing going on, nothing to see. September 30, fear of an epidemic. Over the next week, the Board of Health in Lowell orders more social restrictions. Undertakers are now going to be told they have to limit seating at funerals. Pool rooms, bowling alleys, and bars were allowed to remain open. That's going to change fairly soon. October 7, the board orders pool halls, bars, and bowling alleys to close. At 5 p.m., there's a heavy backlash in Lowell, particularly about bowling alleys and bars closing. And the Board of Health changes the order and moves it from 5 o'clock back to 6:30, and basically says that they're doing that for the convenience of people just getting out of work. Of course, they're also now exposing more people to the influenza. But again, just really interesting to see these parallels. City Council votes $15,000 to fight the influenza. It doesn't seem like a lot of money now, but it's really about 20 times that in today's money adjusted for inflation. So it's a fairly sizable amount of money or emergency money. Federal health officers are now going to come into the city and take charge of the local situation. Catholic Church, Catholic women, Catholic nuns, and the Red Cross are all going to now pool resources to try to deal with this health crisis in the city. The Red Cross is providing provisions for an isolation hospital, and they're hoping that they can keep the nurse-patient ratio at 1 to 30. But it's unclear if they're going to even be able to do that. And that seems pretty high with how sick people are getting. Food kitchens, food pantries spring up to feed people. There's a women's welfare committee in Lowell that gets formed, largely through Federation of Churches. All of these things, again, sort of grassroots neighborhood actions to try to make sure people are fed, people are taken care of. There's a real push to visit elderly neighbors and make sure they're okay. Try to, make sure people are able to get food or whatever else they might need. By the first week in October, daily cases are passing 500 a day, and the healthcare system in the city is totally overwhelmed. And again, you can see the escalation here of the sense of urgency in the pieces from just a month, 3 weeks before, September 18. October 8, no abatement of the epidemic. October 12, emergency kitchens. October 14, influenza bulletin, instructions to households with a whole set of things to do. If somebody in your household is sick, keep out of the sick room unless attendance is necessary. When you read this influenza bulletin, a lot of the things that it describes there are very similar to what everybody was instructed to do if a member of your household came down with COVID, in terms of how you were supposed to isolate them and what the symptoms were and what to do. Avoid, just keep the windows open if you can. The idea was they were saying to people, even if it's cold out, keep the windows open, just put more blankets on. The Lowell Textile Institute closes for a while. At this particular point, it's taken them a while, but eventually they close. The mayor, Perry Thompson at the time, calls a series of meetings on how to minimize the spread, and now it's determined that schools, theaters, movie houses all should close for at least a week. And the emergency hospital would be devoted specifically to influenza cases to try to keep people out of the hospitals. Lots of parallels. Now it's interesting to get a handle on what's going on. The city instructs public school teachers to do a door-to-door canvass of the city and to do it in the neighborhoods where they teach. So there's 13 grammar school districts in the city in 1918. And the teachers in all these grammar schools go out house to house, and they turn in almost 25,000 cards registering households and what the health situation is in the households. And the newspapers report on this as ultimately being something that helps turn the tide, that by knowing where the neighborhoods are, where there are a lot of sick people, knowing the households where there are a lot of sick people, they're better able to target some levels of health delivery. And so teachers doing this are really important. The Lowell Sun talks specifically. The Lowell Sun talks specifically about this the house-to-house canvases, and this is a quote from the Sun piece: "Poverty, lack of English, and sometimes lack of a healthy adult in the home were barriers to better health for many of Lowell's residents. It was through these points of contact at home that agencies found those in need and arranged for the care and that of their families." And so teachers were just incredibly critical resource, something I did not know until I started doing this work. By the end of October, the city council votes to lift the ban on public gatherings. The Board of Health says churches can open, schools and theaters can open, and we're going to see what happens with that. You can probably already guess what's coming. So on the 23rd, let's reopen. On October 30th, a week after that, influenza keeps 3,000 kids out of school, 13 new cases, 4 deaths reported Board of Health, 347 deaths from influenza since September 19th, September 19th. You see the Board of Health report here in the numbers on cases, and so prematurely, in a way, they open up. Similar again to this kind of back and forth we're having these days about when is too soon, or are we being too timid, or what are we doing? But this opening somewhat bites us. Now it becomes a bit even more problematic with the end of the First World War. I have just a few more slides, so we'll have time to chat. As the war ends, we've now had all of these people in battle who have been spreading influenza around Europe, and a variety of mutations and combinations and remutations and whatnot. And as people return from the war, as troops return from the war, people are dying on the troop ships coming back from influenza. They come back, they're let out in New York or Boston or wherever, and they immediately go out into the general public, hug their loved ones, dance and sing, do what people do when they come back from the war. And this becomes in our contemporary a super spreader event. Eventually, they decide to start quarantining troops when they get off the ships and send them in sealed train cars to Devens for a week to 10 days to see if they're symptomatic or not. And at Camp Devens, when they do that in 1918, in the late fall, there are more than 15,000 flu cases there, almost overnight, and a quarter of the camp are ill. 757 people lose their lives. Within a week, 1,000 more people die in Boston. And this is from the super spreader of all these people coming back with variants of the influenza. This gets exacerbated because in the celebratory mode at the end of the war on Armistice Day, November 11, 1918, there were 2 mass gatherings in Lowell, one in front of City Hall, which is the scene here, and one on South Common. Both of those have massive crowds, all really, really close together. It's too hard from either of the photos to see if anybody's wearing a mask or not wearing a mask. Probably not, but can't really tell. But either way, there are these huge crowds that come together to celebrate the end of the war. The one benefit, at least, is they're outside. However, this then ups the ante for the virus. The virus is going to continue throughout all of 1919. It doesn't go away. There's not as many cases, but there's a persistence of cases, a persistence of death. This is an image that appeared in a lot of newspapers in 1919, a chart of climbing death tolls in several US cities, and this includes Lowell. You can see Philadelphia. This is for the end of, this is for late 1918 and 1919. Philadelphia is one of the places that has the largest Armistice Day celebrations, but you can see Lowell here in a pattern like a lot of these other places where the virus is still spreading after a full year. So we're sort of along the same timeline. This is still now 1920. We've gone through 1919. Still a lot of illness. Still a lot of people getting sick, and we still have scenes like this where the Red Cross is meeting in workrooms, making more masks for people, creating medicine kits to bring to people's houses. And so again, this starts in the beginning of 1918. We're now into 1920, and still trying to grapple with this. This is March of 1920. People in Beverly, Mass, where I grew up, although I wasn't alive then, blankets, other supplies for stricken people, making household visits again. One of the ways that Lowell and other communities, Beverly obviously, got a handle on this was by doing those house-to-house surveys and then being able to target and figure out. So it's a version of social isolation, keep people inside so they're not spreading, but also make sure they have food, medicine, whatever they need, and have the Red Cross and church groups and whatnot, sort of mutual aid, bringing help to people so that they didn't have to go out. And again, the teacher household visits were really critical to dropping the numbers in Lowell. They didn't stamp it out. There's no vaccine. There isn't anything like we're talking about now. By the early 1920s, this is a really great book that I read to do some of this research, America's Forgotten Pandemic. Title's kind of ironic in a way, but he makes the point, Crosby makes the point, that by the early 1920s, Americans took little notice of the pandemic, then quickly forgot whatever they did notice. Sort of life sort of went on. And when people talk about the 1920s, they don't talk about the morning of 675,000 people losing their lives to the influenza. They talk about the Roaring 20s. And so the combination, I think, of the war and the influenza and the amount of stress and strain and sadness and loss that sort of created in the world made people try to move on and forget as quickly as they possibly could. The Times of London is writing about life in England during this period of time. So vast was the catastrophe and so ubiquitous its prevalence that our minds full with the horrors of war refused to realize it. It came and went, a hurricane across the green fields of life. And again, the same sort of thing. When you read about life in America, life in Europe in the 1920s, it's all about, again, this economic expansion and growth and these sort of cultural shifts and changes. And we really don't do a lot of critical reflection on what the influenza actually taught us or what the influenza left us with. And so here's a bit in perspective. This is the last slide. 2020, 2021, COVID-19, as of a couple of days ago, 550,000 people have lost their lives. The 1918-20 influenza, 675,000 to 700,000 deaths. Military deaths, US military deaths in the 20th and 21st centuries, 637,000 roughly. So again, it's interesting how we think about these as a society. This book is massive to read. It's very thick. I've read most of it, but Scheidel tries to, in everything he's doing, he's writing about pandemics and plagues back to the Black Death and sort of all the way forward. And he talks about in this book how different communities, different societies at different moments in history respond and make policy choices, as he says, about the consequences of the impact of these pandemics, these plagues, severe shocks, as he also calls them throughout the book. And he makes the point, policy choices that result determine whether inequality rises or falls in response to such calamities. And he says, which I think is right, these choices can change societies in very different ways. And I think it's a really good, I mean, I had a great conversation with my students as I finished, and we sort of finished with this slide to talk about what it means when we think about the health inequities that people are beginning to recognize in the delivery of healthcare around COVID, frontline workers, who's infected, who are frontline workers, who are impacted, who's getting shots, all sorts of things related to to COVID, right? And essentially, we're left with a situation where people who are already living close to the margin in terms of their economic well-being have now tumbled down, into an even worse spot. And so, are we going to try to figure out what to do with that, or will we? Right, this is a question that I pose to my students. Will we simply, as was done in early 1921, sort of say, okay, good, that's over, move along, nothing to see here, and just actually behave as though nothing ever happened? And I mean, I feel like that's really the challenge that's in front of us for probably the next 4 or 5 years as we grapple with the fallout from COVID-19. And with that, I will stop screen sharing. And whoa, look at all you people. You're still here. That's very good. Anyway.
Thanks, Robert. Yeah. So there's 45 people, and I was going to say, if folks want to ask a question or make a comment or anything like that, I think what you could do is either write it in the chat or raise your hand, and I will call on you, and you can unmute yourself. There are, kind of tying into your last slide there, Robert. Ann O'Connor had made a point or asked a question earlier saying, this might come up later, but was there poor and working class folks more likely to die of the influenza, like minorities during COVID? So were the outcomes other statistics?
Yeah, I mean, I didn't find a lot that, I mean, it doesn't mean it's not there, but I didn't readily find a lot that talked in that way. But what I did find is the neighborhoods where in Lowell or in Philadelphia or Pittsburgh or the other cities that I looked at, the death rate was highest in places, no surprise, where people were living in tenement blocks and people were piled in one on top of the other. You were less likely to catch it, and you were less likely in Lowell, in terms of that teacher survey, to really see high concentrations, out in the wealthiher parts of Lowell, like the Belvedere area, or up the hill where I live in Centerville or something like that. People living in single family homes, unattached to anything else, were less likely. Whereas if you're living piled one person on top of another, going up and down stairs every day, and bypassing people and whatnot, the odds increased. Also, more people died. Lots of people died who were in the military, and just as in lots of other wars, generally speaking, it's poor and working class people in the United States that are enlisting in World War I. It's not to say everybody is, for sure, because that's not true. But the large numbers of people are coming from rural parts of the country, and as well from urban areas, those cities that have those high spikes, like Philadelphia and Pittsburgh and places like that. So it's one of the things I want to look more at the demographics, and I'm anxious to figure out whether, I don't know, I haven't tried to look just because it's hard to do this kind of digging right now, but I'm really curious whether those cards that the teachers filled out, those 25,000 household cards, if those are still around somewhere, that would be like, a researcher would weep to get their hands on those 25,000 cards. I mean, that would make, any historian that found those cards would basically, as long as they didn't have a heart attack, would have like 3 articles and 5 books. It would be like, right, your head would pop off if you were able to find that kind of. So I don't know, maybe they're in the attic in City Hall. Have no idea. They're probably buried somewhere. Lowell seems to pack rat save stuff, so they probably are in a shoebox somewhere, and nobody knows what they are. But if anybody out there if anybody out there is listening, if you know where those cards are, call me. I got one more book in me as I reach the end of my career. So.
I wonder how long it took to do that survey, the 25,000, because I think that this influenza was more fast moving than COVID-19. Like it was a quicker killer, I guess. Yep. I don't know what the proper term is, but so like if it takes a week to do a survey, or multiple weeks, if you're doing 25,000 cards, it seems like, how
you figure out how many teachers there were a lot of teachers, and so in each school building, most of it, from what I gathered, most teachers did it, and so they did it in roughly 3 weeks. They started doing it the second week in October, and the Sun was writing about it in their Sunday edition on the 23rd, I think it was. So they did it fairly quickly, and so I'm imagining they almost did it like census takers would. They were real quick. They probably didn't want to. I'm guessing they weren't lingering anywhere. Hi, how you doing? Are you sick? If not, gone. Right? Yeah. You're not hanging out for tea.
No.
So but.
Clever comment from Jessica Weintraub. Onions, the eat more onions idea might have kept people from taking too much of your breath if you ate so many onions.
Yes.
So that's a.
One of my students said, "What about a garlic necklace?" And I thought that was very enterprising. I asked them if maybe we could like make 15 or 20 and go on a corner in Lowell and try to sell them right now and see if we could get any takers selling garlic. I mean, they keep vampires away too, right? I think so. I don't know.
Yeah.
But yeah, the onion thing I thought was cool.
Ann O'Connor also wrote, go into that chart with Lowell and all the cities. it's amazing that Lowell was listed with all those cities. Was that like a Lowell specific chart, or is it something that the AP put out? And then she has a
Yeah,
follow-up question
it
about,
was an AP, yeah, it was an AP column,
wow.
and it was in several national newspapers. And they
And
were
then,
trying to find, they were trying to compare and look at the rates, the accelerated rates of illness among cities of different sizes. And so they didn't just want all big cities, they wanted a range. So there's a range of sizes there. And so Lowell fit as, they're looking for some cities that were 125,000 or so people. And so, yeah, I was really struck when I found it. And the chart, the lines are, it's difficult to read the chart in the slide, but the lines are somehow, and I mean, the math of it, again, you'd have to do more work to really try to dig into it. But the objective of the slide was to show death rates over what was expected. So in other words, they sort of took as a baseline in any given day or week, so many people would die in a city of 125,000 on average, right? There's just an average amount of people. And so the line is how many people above normal. And so when those lines go way up, that's what it's signifying, how abnormal the death rate is. I can see John has his hand.
someone told me John's raised. I was looking for the hand in the participants window. But anyway, John, go ahead. Ask your question. Can you come off mute? I can ask you to do it, but you're going to have to do it.
Okay, I did it. Can you hear me?
There you go.
There you go.
Oh,
Yep, I got you.
Great slides as ever. Very interesting, and obviously the parallels between now and then are haunting. Somebody asked, I just quickly checked, in 1920, the US population was 106 million. So it's about a third the size it is now, a more than a quarter the size it was now. So that figure has got to be seen in relation to that. But you may be thinking about, well, what happened in England? Well, England, shockingly, 230,000 died in England, which is almost half the number in the United States with a much smaller population. The population was 40 million in England at the time. So England got hit really hard in 1920 with the pandemic. I mean, I'd love to hear more from folks about the parallels, because, you know, the fact that we did not learn from history, I'm talking to my friend, the historian here, you know, is really kind of shocking, and how bad it's been, and how all of the similar things, the anti-mask movement, the incompetence of government, et cetera, et cetera. Thanks, Bob, for doing this.
Yeah, I mean, for me, I'll just make this comment and then, yeah, let other people weigh in. I was struck by the way in which the federal government covered it over for such a long time, and that people went along with it. Again, when I started doing this work, I did not know that. And so I always just called it sort of glibly the Spanish flu or whatever, without ever really digging in and thinking more critically. And then when I started reading it, I said, well, I'll be like an old historian can learn a new trick. That it was just really, it was really interesting that, and again, that Wilson, it reminded me of Ronald Reagan. Like Ronald Reagan never, hardly ever, until near the end of his terms, ever mentioned HIV/AIDS. And in the same way, through his second term, 1916 to 1920, Wilson never mentioned the flu. And I was just thinking, okay, how weird is this? And Wilson is supposed to be a learned guy. He was the president of Princeton, for God's sakes. Although, what does that mean? But at any rate, yeah, it's just really, again, interesting.
Anne, you have your hand up.
I always have something to say. Do you think that some of this so-called cover-up, in that they weren't pushing it like we do now, simply that they were a lot more used to having communicable diseases, and public health was in a totally different space than it is now? I mean, they were used to quarantining people. They were used to people dying of things they couldn't avoid.
Yeah, I mean, I do think that, right, that's why sometimes comparisons are a bit dangerous, right? We should have known more this time. With more science on our side, with the polio vaccine and the flu vaccine, in the 50s, and with the development of science related to HIV/AIDS and how it took us a long time to wake up and whatever, we should have, right? We probably should have done a better job this time, right? So I agree. Like the science wasn't as profound in 1918. That's why you have people talking about eating onions or drinking beef broth, or eating mince or making sure you brush your teeth. The interesting thing was how I think in the beginning people underestimated the deadliness of this, and thought, yeah, it's just flu again, right? It's just seasonal flu, and some people are going to die. That's the way it goes. But then I think in Lowell, as more people got sick, people definitely began to panic and realize something needed to be done. And then they couldn't quite figure out what to do because they didn't have all the same tools. They're not tracking things the way we are now in terms of, okay, well, it's going up in Lowell. Is it going up in Lawrence? I didn't see anything as I was reading about Lowell, for example, where they were also cognizant of what was happening in Chelmsford or Dracut or, you know, Tingsboro or, you know, whatever. I didn't see that kind of a thing. On the other hand, what I thought was really significant was the quickness with which the community sprang into action, and particularly churches, clubs, women's groups, a whole host of organizations banded together right away to try to think about how to make sure people were fed, cared for if they needed caring for. And again, the idea of the teachers doing those household surveys, I thought was really brilliant for the time to really try to get the city to get its arms around what was going on. Right, so the comparisons have to be, I mean, I tell my students all the time, you can't be like totally seeing it as everything is exactly the same. Obviously it isn't, but I do think there were lessons that we should have drawn from, there are lessons we should have drawn from 1918. I'm not sure people in 1918 were going to draw on the Black Death, you know, or the bubonic plague for what they ought to do in 1918, but we should have known better with what happened in 1918 through 1920 in terms of our response this time. And I mean, I think we didn't do enough quickly enough. And now everybody's sort of coming out of the woodwork that used to work for President Trump saying, yep, it's really bad that we didn't do something sooner. Yeah, too late now.
Maybe I'll read out a couple comments from the chat, unless someone trying to look at the participant window of the chat and your beautiful faces at the same time. But Susan Lemire says that her father was 10 years old in 1918 and the second youngest in his family. Her mother was second youngest of 12 and a toddler in the influenza period. How I wish I had the opportunity to talk to either of them or any of my aunts and uncles about what the experience was like for them. John Wooding adds that 700,000 Americans died of AIDS since 1982, approximately 30 million worldwide. And then another plug for the book, The Great Influenza by Jessica, the book's not by Jessica Weintraub, the plug's by Jessica Weintraub, as being a great read. And
Yep.
then John Wooding says, 1918 flu killed 20-30 age group more, COVID 70 plus. So that's an interesting statistic. You know, I think the people coming back from war were certainly in that age group that were mostly affected by the. And then I wonder too about the differences in the quicker mortality, and maybe that the virus wasn't able to spread maybe quite as widely because it got people sicker more. John's got his hand too, so maybe Robert.
Just a quick comment on that. From what I've been reading, the flu in 1918 killed more younger people because they'd not been exposed to a flu-like viruses before. Older people had been exposed to a lot of it, so they had an inbuilt resistance. And I guess with COVID, I don't really know, but I guess simply that people in an older age group are much weaker to a new virus like this, are much less resilient to our immune system as well. But interesting that the older people in 1918, because they'd had flu before, had a built-in resistance that the younger people did not have. It's also probably true what you said, Sean, that a lot of the younger people were people in the army who were traveling more and so forth and so on. So just to comment on that.
Yeah, I mean, the real spread was in the military, which I find really, again, fascinating and stuff I didn't know until I started doing the work in preparation for my history class. and you know that it starts in Kansas in pigs, right? I didn't know that, and so there was. I see a question about whether there were conflicts inside the health professions and whatnot. There definitely was back and forths about closing things or not closing things, and whether shutting businesses down, shutting schools down, shutting churches down, those things. People argued back and forth a lot about whether those things had any use value or not, or whether, you know, it was just depriving people of comforting things and things they needed to do. And so that's why, like, one of the big conflicts in Lowell was the Board of Health and the City Council fighting about whether to close pool halls, bars, and bowling alleys. And the first edict was that they all should close at 5. And then there was a big push on city councilors to reopen all of those things and keep them open until 6:30. And so the Lowell newspapers were all talking about this conflict and about how the compromise was reached so that, and essentially what they're saying is workers needed a shot and a beer on the way home. And so they needed to open those things until 6:30 and then close them. There was arguments about whether package stores should stay open or not. And so there were a lot of these similar sorts of questions. I don't know enough to know in the high up in the medical profession, like, were there differences of opinion about possible treatments and cures, and, you know, whether there were any, I haven't found anything that talked about any experimental medicines, or, you know, there weren't fluorescent lights then, so that probably doesn't come to play as it did with our former president. Yeah, it is.
There was bleach, though.
There was bleach, although, and I didn't see any ads about bleach. I saw ads about Colgate, using Colgate toothpaste. I saw ads about washing your hands for 30 seconds with Lifebuoy soap. There were lots of soap ads and toothpaste ads, and they got great mileage out of clean teeth and clean hands will keep the COVID away. And then I mean, the other thing, I mean, which again, I didn't realize, there are hundreds and hundreds of US troops who died of the flu overseas, who were buried overseas in overseas cemeteries. And I was reading about one, I forget where it was in France, there's a cemetery that has 190 US military members who all died of the flu and just got buried there. And we think of like Flanders Field or, you know, Normandy, or, you know, these places that get commemorated on Veterans Day and Memorial Day and whatnot. And again, it was not something that I was aware of until I started digging in. And so this was really, it was an interesting project for me to poke at this in a way that I wouldn't. Now I'm going to teach it all the time. I just used to gloss over and say there was a flu and a bunch of people died, and then go on to the Roaring 20s. And now I realize I've like shortchanged my students for the last 19 years. So, oh well.
Not exactly related, but this, I think 1918 was the year of the molasses flood in Boston and the Boston police strike, yes, too. And there's a lot's been made of, you know, the war, the pandemic, and all that in fiction and, you know, different histories too. Yep. So yeah, a lot of things on the churn that year.
Yes.
I want to be mindful of time. It's about 7:59. So I think what I'm going to do is maybe close out the formal talk and say thank you very much for giving an excellent lecture. And I'm gonna stop the recording, and I'm not going to force anybody away. If the conversation wants to keep going, we'll keep going. But thank you, Robert. This was really enlightening and really enjoyed it.
I'll stay for a while if anybody wants to chat. I see all these people I haven't seen in eons. Hi, Brenda.